How can kidney transplant patients reduce lifelong medication? Imagine waking up every day knowing your health depends on a carefully balanced routine of medications. For kidney transplant patients, lifelong immunosuppressive drugs are essential to prevent organ rejection. But there are ways to make this journey easier and safer. One key approach is simplifying medication schedules. Switching from taking drugs twice a day to once a day can make it easier to remember doses, which improves adherence. For example, using once daily tacrolimus has been shown to increase how consistently patients take their medicine. But it's important to remember that missing a single dose of a once daily medication can have more serious effects than missing one in a twice daily schedule, so close monitoring by healthcare providers is crucial. Regular medication reviews are another vital step. Doctors can assess which drugs are still necessary and which can be reduced or stopped, especially in the early post-transplant period. This process, called deprescribing, helps cut down on the number of medications and minimizes the risk of side effects. Using alternative immunosuppressive drugs can also help. For instance, some patients might benefit from biologic agents or newer medications like belatacept, which may lower reliance on traditional drugs like calcineurin inhibitors and steroids. Adjusting doses based on therapeutic drug monitoring is also important. By measuring drug levels in the blood, doctors can personalize doses to keep them effective yet safe, reducing unnecessary exposure and side effects. Managing side effects proactively and educating patients about their medications can greatly improve adherence. When patients understand why they need their medicines and how to manage common side effects, they are more likely to stick with their treatment plan. Supportive tools like reminders or counseling can also help. Cost is another factor. Using approved generic medications can reduce expenses and make it easier for patients to stay consistent with their treatment. However, only generics that are certified as bioequivalent should be used to ensure safety and effectiveness. In summary, reducing the lifelong medication burden for kidney transplant patients involves simplifying dosing schedules, regularly reviewing and adjusting medications, monitoring drug levels closely, managing side effects, and providing thorough education. All these steps should be taken under the supervision of healthcare professionals to balance the risk of rejection with the goal of minimizing medication-related issues. As ongoing research and new therapies develop, future options may further help patients manage their health with fewer medications while maintaining the success of their transplant. Always remember, every patient's situation is unique, so personalized medical advice from your healthcare team is essential.